Hey y'all, welcome back to my channel. It's Maris Explains It All. You guys, I have not filmed in a couple of months because I had the baby! I figured you guys may have guessed with my abrupt absence that all of a sudden I was pregnant, and then I didn't film for a couple months that I actually had delivered. And so I've been taking my maternity leave, and I figured I would just take a break from YouTube as well, because if any new parent knows, it is really hard to film and do anything with a newborn in general, so especially filming. So I am trying to do this in between naps, and my husband is actually working on the house today, so there may be some background noise while he's doing some honey-do list items, but the baby is asleep for now. We'll see how long that lasts. But I figured I would come on here and talk about my story and just kind of what I went through and delivering a baby with COVID. Well, the baby didn't have COVID, but I apparently did. So I figured that might be interesting to folks. I always like to hear other people's birth stories, so I'll try to keep it not super gory. I'll try to keep it a little bit PG. So if that sounds interesting to you, be sure to subscribe to the channel and hit the notification bell so you're notified anytime I upload, and I will be right back. So I should grab a coffee for this. This is better. For any new parent knows that coffee is life, and when you don't have energy and it takes so much energy to film through YouTube, you need some coffee. So yeah. So it all began on a rainy Tuesday. No, actually I think it was sunny. But I went to the OB's office for my weekly checkup, because you have to go weekly, and I made it to 39 weeks. I made it all the way almost to 40 weeks. I was a week before his due date, and I went into the office and they do the routine checks like they always do. They do the weight, and which is super scary. I hate when they weigh you when you're that large, but so they do the weight and the blood pressure check and the urine test every time. So they did all that, and I noticed as the lady was putting in the numbers into the system, I was kind of watching her enter my results, and I noticed that there was protein in the urine, and it had it wasn't zero, it was some amount, and I was I don't think there's supposed to be protein in the urine. That's not a thing that is supposed to happen. So my midwife came into the exam room and she said, do you have any concerns or questions for me? And I was yeah, actually I noticed that the nurse was entering some data for me that I was confused about, is what happened with my urine test or whatever, and the blood pressure seemed high as well. And she said, yeah, I want to talk to you about that. So you're gonna need to go to the hospital. I was like, what? She's like, yeah, you're gonna need to go across the street to the hospital. We want to do some more tests. You have high blood pressure, and you have some swelling in your feet and ankles, which my feet and ankles were huge balloons, so I already knew that was a thing. And she's like, and your blood pressure's high. I can't remember what it was, but something 145 maybe, or 150 over something 90, 100. I was like, yeah, that's higher, because I've always had really normal blood pressure. So I was like, okay, that's pretty high. That's not a good thing. So I was like, okay, what does that mean? Go across the street to the hospital? And she's like, well, they're gonna do some more tests on you, and yeah, we'll see what happens. And I was like, okay, curious. So I leave, and I'm like, okay, I guess I'm going to the hospital. So I went across the street. Thankfully it's really close to my house. Everything's right within 2 blocks of each other. So I went there, went up to the OB's department, and it's the maternity ward, and it sounds like a psychiatric ward. I went to the ward. Anyway, I went to the maternity floor. That wasn't a prisoner. And so I went, and they did more tests, right? They checked me in, and they said, oh yeah, we're gonna do some blood work. So they did the blood work, and they did more urine test, and then they had me hooked up to a blood pressure cuff for a continuous check of 10 minutes. So every 10 minutes the cuff would go off and check my blood pressure. So the nurse comes in and she says, yeah, you have preeclampsia. And I was like, what? And she was like, yeah, it's not a big deal. And I was like, not a big deal? Do you guys watch Downton Abbey? Lady Sybil died of preeclampsia. Okay, yes, it was the early 1900s, but still, I was like, people die of this. This isn't, so anyway, I was trying not to freak out, because that made my blood pressure worse, right? And so she said, yeah, not a huge deal. It's just a mild case. I'm like, okay, thank God. And so she said, well, you're gonna need to stay and deliver today. And I was like, what? I wasn't ready. I don't know what I was doing for the last 39 weeks, but I was not ready. I was like, no, I have another week. Okay, I haven't packed my hospital bag. This is not happening. I'm gonna go home, and I gotta do my dishes. I have to clean the house. The house is dirty, and then I'll come back, and then I'll have the baby. And she was like, no, sweetie, no, you're gonna stay. And I was like, no, I don't have my winter pedicure on. I have my Christmas pedicure. Like I had Christmas decorations on my nails and like Christmas colors. I can't be delivering a baby in late January with Christmas colors on. These are the stupid things that go through your mind when you're in denial. But I was like, how am I supposed to deliver a baby in January? I wanted to have my baby nails, you know, like my baby boy, like specific colors. I don't know, blue nails or green or some color or whatever. No, that wasn't happening. So they did all the paperwork and they were like, okay, we're gonna actually move you. This is just an exam room, you know, kind of hospital room. We're gonna move you to an actual like delivery room. I was like, okay, it's getting real now. It's getting real. So they moved me to the room. My husband thankfully was there. I sent him home. I was like, okay, you got to go pack a hospital bag because I don't have anything here. I walked in with these clothes and my wallet. Like that's all I have. So he went home and poor thing, like he FaceTimed me. And of course the first thing I did was like, you need to pack a whole makeup bag, okay? And I know that sounds crazy to some people who wouldn't even consider doing their makeup in the hospital, but that's just who I am as a person. Like I wanted to look nice and I wanted to have my makeups there, and you know, bless my husband, he's wonderful. He got on FaceTime with me and he like went through my makeup, you know, my whole makeup collection. And I was like, no, not the Anastasia Beverly Hills. No, this one, get the Urban Decay, get that one. So anyway, he was like, you know, just going through all this stuff with me. So he did wonderful. He packed me a simple makeup kit and of course all the other things that I had, you know, on my list to pack. So he brought it all to the hospital. I got a shower because I was like, all right, I don't know when I'm gonna shower next. Like this is about to go down. I'm freaking out a little bit, need a little hot shower to calm me down. So I was already like so nervous like before everything started, being a first-time mom, you know, if you couldn't tell, I'm a first-time mom. So you know, he gets there, and so anyway, the nurse comes in and they start all the paperwork and all the things you have to sign your life away for. And then we went through the process of hooking me up to all the fetal monitors and everything. You know, they had it across my belly. So they hooked me up so I could hear his heartbeat, which was great. I loved hearing his heartbeat and making sure it was strong and healthy and just, you know, continuously there. And so they did that, and then they put the IV in. Oh my gosh. I had never really had an IV like they did it before. Like I've had one in my arm one time, but they put that thing, I gotta put my coffee down for this. They put that thing in my wrist, like on the side of my wrist. It wasn't even in the hand, right? You'd think like it's in the hand. No, they put that jank right here. There is not a vein big enough on the side of my wrist to find. Like they really went in, y'all, and it was not good. I can't even describe to you. I hated having the IV. It hurt so bad, and in fact it bruised for like I think 3 to 4 weeks after. I had a giant bruise from where the IV was. I don't know if she did it right, to be honest with you, because I kind of felt it the whole time. But yeah, I thought that was going to be the most unpleasant thing in childbirth. I was wrong. I was like, well, hey, if I can do this, I could do the birth. Oh, silly, sweet summer child. So they gave me the Cytotec pills. They started, this is Tuesday night on the 12th of January. They gave me these Cytotec pills, and I was like, okay, it's gonna start your labor, soften everything up. I'm like, okay. So they gave me 3 pills a few hours apart. And so, you know, I have the IV going, I have, you know, the fetal monitors going, I have the blood pressure cuff still going. The blood pressure, you know, was still something that they wanted to monitor because, you know, preeclampsia. So I had all these things like hooked up to me. I couldn't really move a whole lot, which was unfortunate. I was too amped up to sleep. Like, I think I dozed off a little while, tried to listen to an audiobook, trying to chill out, but I was so amped up. So after the Cytotec pills, like I was laying there and I was kind of coughing a little bit, and I don't know, I think it was because I was just, I don't know, hyperventilating a little probably. I was like just laying there like thinking about it in my mind. And so I started coughing and I sat up, and the nurse was like, you know what, I didn't test you for COVID yet. I'm gonna test you for COVID. And I was like, what? Okay, whatever. Do I have to be tested for COVID? Like, I don't have any symptoms, I'm fine. And she was like, yeah, let's just do it. And so they did. She brought me in and they did the whole like, you know, tickle your brain thing. And she was like, okay, I'm gonna send this off. It was a rapid test. It came back positive. I was like, I'm sorry, what? This was like the second time that I had the like, what now moment. And she was like, yeah, you have COVID. I was like, no, I don't. I don't have any symptoms. I'm not coughing. Like, I mean, I coughed like a little, and I think it was psychosomatic because it only lasted like a couple minutes, and then I didn't cough anymore after that. So I coughed for like a couple minutes. But aside from that little, like, I think psychosomatic little episode, I said, I don't have any symptoms. I feel fine. My I don't have a fever. Like they were testing my temperature. It's normal. I don't have any like sinus stuff. I don't have any like, I don't know, drip or sneezing or achy or loss of taste or smell. Like I don't even have a headache. Like I feel fine. I feel like this. So she was like, yeah, you have it though. And I was like, do I though? She was like, yeah, I don't think I did. But anyways, I might have been a false positive, but regardless, they had to take it seriously. So they moved us, and this is such a sad thing because they moved us to a different room. So when you have COVID, I guess they had in the hospital, they have an isolation room, especially where I was at in this ward. But so they moved me to a different room, and it wasn't like the nice like hardwood floors room with like the canned lighting, and they had like a little baby warmer. You know, you were there with the baby the whole time. They moved me from that room, which also had a little separate pull-out couch for my husband to sleep, and he was like able to sleep flat, and it was nice. They moved us from that to the isolation room. This room was like, I don't know, an overflow room. It was kind of like hey, here's an extra hospital room. It's kind of small, but let's just cram a bunch of extra equipment in there. There was like not room for anything. And there wasn't a pull-out thing for my husband to sleep. There was only like a little recliner that kind of reclined. And so he really, poor thing, could not sleep on that. And then the room was so small that the hospital bed itself was like, not enough room for the midwife to be at the base of the bed, the foot of the bed to deliver me. She had to angle the bed because it was like, you know, the two walls. So if there was not enough room at the end of the bed between that and the wall, she had to like angle the bed so that she could like stand down there and deliver. So my bed was angled. I was like, this is so small. And there was no place for the baby. So the baby, when he was born, he had to be taken away to another room because they couldn't have him in there with me with the warmer, so basket thing. So there's just not enough room. It was just small. And then the shower was tiny. And they had stuff stored in the shower. Like they had all the hazmat bins and like gowns and stuff. It was all stacked in there. And so there was really only a toilet. I couldn't even use the shower because they were like storing stuff in the shower. So I was like, this is unbelievable. But the isolation room has like, I guess, some kind of pressurized thing where like they pipe in fresh air from the outside, and then the air is like piped outside directly. And so it doesn't go into the doors or whatever. It's like I forget what it's called. It's like a pressure backflow. I don't know what it's called. And then to make things worse, I felt so bad for the staff because they had to really like mask and gown up. They had to put on all the PPE before they came into the room every time to check anything. And so it wasn't just like they popped in with their mask on. They had to actually do a full gown, the booties. They had to wear a mask, like sometimes double mask. They were wearing a double mask and a face shield. And I felt and gloves. And I felt so bad that they had to do that every time because they had to check me so frequently for things, you know how they do in the hospital. And they had to do that every time they came in. So I do feel really terrible that I just had to, you know, that they had to do that. But anyway, so here I am going through the Cytotec is doing its thing, and they were like, okay, well, we're gonna go ahead and try to use this device called a Foley bulb to help get you dilated. And I was like, okay, that doesn't sound fun. By the way, no one told me that the cervical checks are so much fun. I was like, this is the worst pain ever. It wasn't. Not compared to the labor. I was like, oh my gosh, okay. So they did the cervical check once, and I was like, I'm done. You're not doing that anymore. I don't care what I am anymore. So you had one shot at telling me what I was. No more checks. I don't care how many centimeters. You're just gonna have to guess. So we're not doing this again. If you can't tell, I don't handle pain very well, and I don't have a very high pain tolerance. So yeah. So I get ready to do the Foley bulb, and they're like, this is gonna be unpleasant. And I'm like, everything I've experienced so far has been like painful. Like, if you think this is unpleasant, you're gonna need to give me something for the pain. And they were like, yeah, we're gonna go ahead and relax you with some fentanyl. And I was like, okay, I haven't really done a whole lot of research on fentanyl. It's probably not the best, but I was like, I would like to do whatever I can do to kind of relax. So, and I was like, isn't this like the street drug? So they gave me a like dose of fentanyl, and it definitely relaxed me. I definitely felt like much calmer right away. I kind of chilled out. I just kind of felt like, okay, I'm relaxed now. And they put in the bulb, which was again super unpleasant. Yeah, painful, but you know, it did its thing, it did its job. And then they said, well, we're gonna start you on some Pitocin, right? So it's like the synthetic form of oxytocin, which helps you dilate and deliver. So I was like, okay, well, if you're gonna do Pitocin, I know the deal from other friends from what Pitocin, like, you're gonna need to give me the epidural now. I want the epidural. So I pulled that epidural trigger quick. Like, I pulled that trigger like probably at 2 or 3 centimeters. I was not very far in before I said, just give me the drugs. It wasn't, so contractions weren't that painful actually at that point, but I knew the Pitocin was gonna make them like really bad pretty soon. And then they were gonna break my water as well. And I was like, okay, yeah, if all this is happening, you're gonna need to give me the drugs, because this is when it really ramps up. So the anesthesiologist came in, and he was a very nice guy, but I think he was experienced, but he had a hard time finding a good spot on my back. And so I was like maintaining that perfect, like rounded back position, like that C position. And you know, I'm contracting a little bit here and there, but like it wasn't super painful yet. So it wasn't a big deal for me. And I had the fentanyl to kind of relax me. So I was okay to sit there and stuff, but it was only supposed to take 5 minutes, and he was in there for at least 15 minutes trying to find a spot. And he would like, it was just so nerve-wracking knowing someone's in there monkeying with your spinal cord. Like your spinal nerves. But anyway, he poked me a few times before he really got something, and so that was really unfortunate. It didn't actually hurt. I was really surprised. I thought that the epidural was going to be a lot more painful, and just the whole process was going to be like super unnerving, but I was a little nervous, just, you know, someone's, you know, messing around back there, but I tried to just relax and breathe, and he did a good job at, you know, keeping me calm and everything. I wish my back would have been easier to find a spot. They said I had like a bony back, I guess, and so I wasn't able to really like find a good spot for the epidural. So they did poke me a few times, but then we were all good once the epidural kicked in. Y'all, the epidural is worth it. Definitely get the epidural. So I did finally, like once it kicked in, it was great. Like it didn't take very long to kick in, and I definitely felt like I mean, I wasn't really contracting very heavily anyway, but it was just able to kind of relax. Your body was able to kind of relax. And so I actually fell asleep, which was wonderful. Fell asleep for like a little while. And after that, it was hours of changing bags of Pitocin out. And then the pain kind of kept getting like progressively worse. And I was not sure why, because I'm like, well, I have the epidural, right? Like I shouldn't be able to feel anything. You know, it got to the point where I was like able to breathe through them. And then it got to the point where I was like, oh, this actually really hurts. And I was pressing the little button. You know, you can press the little button to release more medication every 15 minutes. And we were doing that just to make sure that like there was a continuous flow. But it just kept getting worse and like worse. And I was like, oh, this is not good. I don't like this. And it got so bad for like, I don't even know, it must have been a couple of hours of just awful pain. I mean, I vomited, and you know, that usually means you're getting a little closer. I was probably around 8 to 9 centimeters at this point, and the pain was just, I can't even describe it. Like I wish I could, you know, I wish I could describe it to people, and it's just indescribable, just the level of intense pain that I was feeling. And I was trying to do all the breathing, but the pain was so bad that it like took my breath away every time. And I actually wanted to vomit with every contraction. Like I didn't, but I wanted to. There was no words. So I was taking in these like deep breaths and like, you know, moaning and just making all these noises and trying to just, you know, do whatever I could to cope with the pain. But I asked the anesthesiologist, like, is there anything else you can give me? Because this is really like unbearable. My pain level is, I don't know how to rate it, because I don't know what the top of the scale is for me. Like I've never really been in any kind of pain. Like I've never broken a bone or anything. So I don't know what the scale is for me, but I feel like it's like a 9. It's gotta be a 9 out of 10. Like I am dying here, and it's just so bad. I just don't want to do it anymore. I was almost like, just cut him out, like do a C-section. I can't do it. And I was like, why is this hurting this much if I has an epidural? I don't understand. So I don't know if that's everybody's experience or just me, that if he didn't place it correctly, or if it wore off, maybe I got it too soon or whatever. But regardless, they switched me to a different kind of epidural medicine. And so that was, before they had me on a kind where I was numb, but I wasn't like dead numb. I can kind of still move a little bit, my lower extremities, and I kind of could feel the pressure. And then when they moved me to this different kind, I didn't feel anything. Like I was a dead weight. It was like heavy. And so I don't know what it was, what happened to where I was feeling all that pain. And I know he got stuck. So he got stuck actually in my pelvis. He was hitting my pubic bone, I think. And so he got stuck, and I think that might have been some of the pain I was feeling. But anyways, after that new medication came in and I was like numb, it was much better. But then I couldn't feel the contractions when I was having contractions, which was fine. But it came time to push. And so they told me, like, go ahead and start pushing then. If you're at 9 centimeters, you're close enough. Let's see if you can get past him through, you know, and he's stuck. So let's see if we can get him down a little further. You know, go ahead and push now. So I did, and he didn't go anywhere. I didn't push correctly, and so it helped a little bit. I think once they swapped out that new medication, it definitely helped when I was super numb. And so they had to tell me when I was having a contraction to be able to push. It was such a relief not having the pain, you know. And so they were like, okay, here comes another one. Go ahead and push. And so I did. And after a while of that, they were like, yeah, this is not really doing anything. You're gonna need to really push. And I was like, I am really pushing. Like, what do you think I'm doing here? And so she said, okay, no, you're not pushing with the correct muscles. And so she, you know, redirected me to push with the right muscles. She said, she explained to me what I needed to do. And so I pushed in a different way. And then it was much better. She said, okay, there you go. Now you're making progress. He's coming down. So finally I got to the point where, you know, I was pushing, and it was just so hard I was just out of breath. I was just so out of breath. It was really hard for me to hold my breath long enough to actually bear down and push for that long. But they kept trying to get me to like push for a full like 10 seconds or at least a 10 count. And I was only able to push like little bits at a time because I was just so out of breath that I would have to stop and catch my breath. But anyway, it worked. And finally he arrived, he came out, and he was screaming, which is great. The nurses said that was a great sign that he was like, had a great set of lungs, and he was getting all that stuff out of, you know, junk out of his lungs. They didn't have to suction anything really. So they, he was yelling at the world. So they immediately put him on me, and it was such a wonderful, like, emotional time. And they put him on me, and I was like, oh, you know, I don't even care that he's so, you know, covered in yuck. He's kind of gross, but I don't even care. So, you know, they put him on me for just a minute. It wasn't long. It was probably a couple seconds. I think all total said and done, from the time they gave me the first Cytotec pill, from the time that, which is supposed to start the labor, and she said I was having contractions actually at that point, which I didn't even know. When they gave me the Cytotec pills when I first came in, I didn't even know I was having contractions. I never felt anything. So I suppose the contractions were happening then. From the time there was that until the time he delivered at 10:16 p.m. on Wednesday, it was 24 hours. So it was a 24-hour labor, I guess you can consider it, but it wasn't really painful until, you know, sometime in the mid-morning. So I really only had painful kind of contractions for a few hours, and then my husband said I was pushing for about 2 hours, which it didn't feel like 2 hours to me. I think when you're in it, like, time is like warped, and just you just have no concept of like what time it is. You're just in a whole other zone of concentrating and pushing and trying to breathe and everything. But so he was finally born. They took him away, unfortunately, to the other room. He wasn't able to stay with me in the room, but he was taken away. He was cleaned up, and he was gone for like an hour, which was so sad for me. I really wanted to see him, you know, like, he just came into the world, and I want to meet him and see his little face, but I didn't get a chance to do that for like an hour or more when they were just doing all the stuff they have to do with babies. So normally they would be in the room doing it, so I could at least see him across the room, but of course we were in the isolation room, so he was taken away to a different space. But anyway, they stitched me up. Yes, there were stitches involved. That was not pleasant. So there was a little stitching, not too bad, kind of a first degree kind of situation, but so that was a blessing. It was just a surface steal, not a deep tear. So anyway, then that was it. They had me kind of all packed up, and they ported me over to a recovery kind of room where I spent the next few days. Actually, they wanted to monitor me because of the positive COVID test and because of the preeclampsia. So I had to stay from Wednesday through Friday. So it was only a few days, I guess, a couple days. It wasn't too bad. But we'd been in since Tuesday, so it just felt like forever, you know, Tuesday, Wednesday, Thursday, Friday, like 4 whole days in there. we really wanted to get home. So throughout the next few days, it's really just a blur. I mean, I tried to nurse him as soon as I could, kind of nursed every few hours, of course, and then they took him away to do all the well baby checks, and they tested him for COVID actually, and thankfully he was negative, so he didn't get it. And the nurse told me that the babies really aren't seeming to catch it, and they don't know if it's because the mom gives antibodies to the baby and they're like sort of like immune to COVID, or they're just not getting it for some reason, which was wonderful. I was so happy he didn't get that. I did wear a mask the whole time, like when I was nursing him, just to make sure that, you know, there was not like, I don't know, risk of just passing it to him. But I mean, he was so close to me that I feel like he would have maybe gotten it. If I'd had it maybe. But anyway, my husband didn't have it either, which was another sign that made me think it was a false positive. But anyway, those days are a blur of trying to sleep but not really being able to sleep much, because I just kept wanting to look at him, you know, the whole time. You're like peeking in the little bassinet. I think because we had COVID and because they think it's best for baby to be with mom the whole time, they kept him in their room with me, so he didn't go to the nursery. Everybody kept saying like, send him to the nursery, you'll get better sleep. But I asked if he could go to the nursery and they're like, no, you know, we really want him to stay here with you. And I was like, okay, I guess I can see that. You want to stay with mom, and it's always better to be in the room together and kind of bond as a family. So we did that, and it was really a special time. But it was difficult to get any sleep with him and making the little baby noises and coos and cries and things. And every time he would make a peep, you know, my eyes popped open and I was like, is he okay? You know how it is. So that was that. That was it. They monitored me. I did have something really scary happen where I was actually leaking some kind of clear fluid from my epidural site. And I talked to the anesthesiology department, and they were like, I said, hey, you know, I'm like soaking through, you know, I'm kind of like soaking through a pillowcase here, you know, like it's kind of fluids leaking, like, can you come check this out? And so they did. They looked at it and they were like, huh, yeah, I don't know what that is. And I was like, sorry, what? It was my third like moment, like, you don't know what that is? I mean, you do this for a living. Is it spinal fluid? I mean, is it like just watery kind of blood? Like what are we looking at here? And they're like, yeah, I'm not sure. Let's just bandage it up and we'll just keep an eye on it and see. And I was like, do you not want to test it? Like, am I leaking spinal fluid? So she said, well, if you have headaches, you know, let us know and, you know, we'll tell you. But I'm like, well, I'm on ibuprofen, like these high ibuprofen for the recovery pain anyway. So I wouldn't really probably know if I had headaches, but anyway, it turned out fine. After like a day of that, maybe it stopped leaking, and I was like, okay, well, I hope that wasn't a serious thing. So I guess it was fine. It stopped, so that was good. Recovery wise, you know, it was, you know, a little painful, but you're on these 600 to 800 milligram ibuprofen for the pain, so it wasn't horrible. It was manageable, so that was okay. And yeah, so then we were discharged, and we finally were able to come home and introduce him to his little nursery, which we had finally, you know, we had finished not that long prior. And I actually have a nursery reveal video that I was editing and was going to post, and I didn't get a chance to because I went into labor, or I had to be induced. So anyway, that's the story of what happened and just kind of the experience with COVID. I'm thankful that I didn't have to wear a mask during labor. I'm thankful for that. And I'm also thankful that the baby didn't have it, my husband didn't have it, and I'm thankful that I had no symptoms. And I'm just, I don't know, the only thing that we really had to deal with was just the isolation room and just the PPE, the nurses and doctors having to wear their equipment and everything, and having to wear a mask when I nursed him, just being so close to me. So those were kind of the unpleasant things that we went through with it, but I guess better safe than sorry. And then we came home, and then the real work began. So once we came home, it was fantastic. Like especially for the first, like I'd say few days to a week, it was so idyllic. And I'm sure there are hormones involved with this process that made it this way, but I never thought of myself as being like super mushy, you know, emotional, like even super maternal necessarily. I kind of am more, I don't know, rational and thoughtful about things, and you know, analytical sometimes, but I could not put him down. Like I did not want to put him down. I just held him the whole time, and I was just wanting to like you know, smell him and love on him, give him kisses, and like, I was just an amazing, like, wonderful bonding time with him. It was just so awesome just to be able to see him, and those little reflexive smiles in the beginning, you know, he's not smiling consciously, but those little tiny smiles in his sleep and everything were so precious. And so we had a wonderful, like, first few days, although he did not like to be put down. And so he certainly was held like his whole 24 hours a day for a while. So that was our first kind of experience. And I'm sure you can probably hear him maybe fussing in the background, crying. I think Daddy just went and got him. Now, I have to brag for just a second. Like, I cannot tell you how amazing my husband was during this whole process. Like, I wasn't sure. We'd never really been through anything traumatic, you know, kind of together. And I think it was kind of traumatic, personally. I think maybe every birth maybe could be traumatic, classified as that. But he was amazing, just a wonderful coach, and just during the labor, just there with me the whole time, encouraging me, just, you know, holding my hand the whole time, breathing with me, just, you know, praying with me, like, just amazing, amazing experience with him. And then to see him step into that dad role was also just so special. And he always has kind of like been that kind of a personality. He always kind of was a dad, you know, and so it was wonderful to see him just hold his son for the first time and be able to just bond with him. And he was so amazing helping me too. So he would come and bring me water and snacks when I was nursing, and he would just take him if he was crying. He would come and take him so I could get a break. He would watch him for hours on end so I could take naps. Every night I'm able to go and get like a nice long bath and just kind of relax for a couple hours, and Dad takes him. And so it's just really amazing. I know not everybody has that gift to be able to have a strong partner, and I have just amazing respect for single moms who go through this without anyone really there to help them, because I don't think I would be sane if I had to do this all by myself 24 hours a day, every day. It was just a nice blessing for him to be able to kind of step in and be like a really strong partner, you know. Anyway, so thankful, big thank you to my husband for that. And yeah, so since then we have had a few trials. I think every baby kind of has their things that they go through. And so we struggled a lot in the beginning with colic. And so that was really unfortunate. We went through, I'd say, some pretty dark, you know, nights and days. He wasn't as bad during the day. He would sleep more, but he cried all the time. I felt so bad. We tried everything we could think of to get him to you know, solve for whatever was bothering him, you know, if it was his tummy issues or whatever. We were trying everything we could. And so for, I think the first few weeks, really, he had colic. So he would cry and cry for, I mean, sometimes he would start up in the evening, and they say it's worse in the evening. He would start up in the evening, maybe around dinner time, and he wouldn't stop until maybe 2 or 3 in the morning. He would just cry and cry and for hours and hours. And it was so hard, just exhausting to like listen to the sound of the cry, and it's heartbreaking to be able to not like know what to do for them and not be able to like help them. And so we both tried everything we could. We found the happiest baby on the block, Dr. Karp, the pediatrician, his methods of the 5 S's. So we tried swaddling, shushing, swaying, side position, and sucking. And so those are the 5 S's. And so we did swaddle him. We kept him swaddled all the time. And he liked that because his arms would, when he would finally fall asleep, and his arms would flail, you know, and they would wake themselves up. It's called a Maro reflex. They would just jump, and he would wake himself up and start crying again all over. And so we're like, oh, so we had to keep him swaddled like tight all the time, which they like anyway. And then we tried him on his side, you know, or a stomach position a lot. We tried the colic hold, where we're kind of holding him like head in your elbow, and then like, you know, holding the rest of him. So we tried the colic hold, and we introduced a pacifier super early. I know you're not probably supposed to as early as we did a couple weeks in, but we just tried everything to get him to be comforted. And so we introduced the pacifier, so that was the suck portion. Babies love to suck. And so we did that, and then we tried swaying. Of course, it's not just me, my husband and I spent hours and hours and hours pacing, just walking and swaying and pacing the living room with him to try to get him to go to sleep and calm and quiet. So there was that. And then we bought a shushing machine. The baby shusher is like a little gadget that you can buy on Amazon, and it shushes, you know, this constant, you know, constant noise. And essentially you're just trying to mimic what they experienced in the womb. So just that, the noise, the constant shushing or whooshing noises of like when the mama's, you know, heartbeat or bloodstream, you know, kind of rushing. So you're trying to mimic that. And then the swaddle helps with the tightness and the warmth of, you know, what they experienced there in the womb. And then just the rest of it, you know, swaying. They were constantly being rocked, you know, in utero. So we tried to mimic all that, and it did help somewhat. We did switch his formula, you know, we tried gas drops, we tried gripe water, we tried a lot of different things. And so by trial and error, we found the combination that worked best for him. And then the real game changer, y'all, was the snoo. The snoo bassinet is worth every penny. So we did not really know about the snoo until my sister-in-law told me about it, and it was amazing. I know that some people may be against that because it introduces sleep crutches, you know, like they have to be, it introduces the motion and all of this, basically the stuff that Dr. Karp teaches, because he's the one who helped create the snoo. But I think it's worth it because he was not getting deep sleep, and I was getting no sleep because I had to hold him 24/7. Like one of us had to switch off and we had to do shifts, and we always had to hold him because if we put him down, even when he was asleep, he would instantly wake up and start crying. So the snoo was amazing because it is a bassinet, a smart bassinet, if you haven't seen it, and it swaddles them, so you can wrap them up, and it swaddles them, and it has them clipped in place so he can't move or can't roll. It's like super secure on their back. And then it rocks them gently from side to side and gets kind of that like nice head jiggle going that they need, the swaying motion. And then if they start crying out or start getting upset, as you can probably hear up there, he's making little noises, it rocks them harder. And so it just kind of increases the intensity of the rocking, and then it has white noise piped in, and the white noise will get louder and play different sounds to help them get back to sleep. And then after a couple minutes of that, if baby still is unhappy, the snoo will send an alert to your phone and say, hey, you know, you need to come get your child, come get your kid. I've done all I can. So they're not really crying for that long. It's only a few minutes at a time. And so it shuts itself off, and you have to come in and get them. As you can hear, he's up there probably hungry. So I'll wrap this up. But anyway, the snoo is amazing. If you can't afford to buy it, like we couldn't afford to buy it, it's quite expensive. You could rent it. So it's about $130 a month, I think, for us to rent it. And we're doing that for just a few months. So it was totally worth it because I put him in the snoo, he's able to go down and he goes to sleep, and then I'm able to sleep. So I had not even seen my bed to sleep. I was sleeping on the couch with him, like trying to you know, sleep wherever I could. I hadn't even seen my bed, and so for like the first month of his life. And so finally I was able to get some sleep, and the snoo made it so that he was sleeping maybe 5 to 6 hours a night sometimes. And I was amazed. I thought he was dead the first time. Like I was like, he's got to be dead, because before he was sleeping for like 30 minutes. He would cat nap, you know, and then he would wake himself up, and then he would be crying all night. So that was just amazing to be able to put him down and even just get 3 hours of sleep continuously. So that was fantastic. So that has been a game changer for us. Highly recommend the snoo. So that is my story. Hopefully it was interesting. Feel free to leave any comments below about your experience, what your birth story was like. I always love to read them. I'm super interested to hear how other people did. So yeah, let me know if you have any questions. I'm happy to kind of answer some about my experiences, or I think I might come on here and do a video of some of my favorite baby equipment or favorite things that I have found helpful for baby. So I'll put in a picture here. We're probably not going to have him introduced on camera, just to kind of respect, you know, the privacy. And I don't know, there's a lot of people online nowadays. I don't really know if I want them looking at my kids. So I'll put a little picture in here. We did a newborn photography shoot, but we probably will keep him off camera. But that's it for now. I will see you guys in the next video. I think I'm going to go ahead and post that nursery reveal so you guys can see his nursery and how we ended up finishing it. And I'm going to go feed little man. So I will see you guys next time. Bye guys.